Well, you are a rapidly settling crowd, and you're still oriented. You are in the geographic center of the borough now. Do you know that? You've landed in central. How many of you have been to central Brooklyn or haven't been to central Brooklyn before? Aha! Welcome. This is the place to be. You'll never get out, but we're glad you're here. So welcome. My name's Rich Rosenfeld. I have the honor of co-chairing this event with Beth Helsner, who I will introduce very shortly, but just wanted to give you all a warm welcome. This is a really unique and special event for Downstate. It's our first ever plant-based conference, and it really is a tremendous effort between the College of Medicine, the School of Public Health, and the Brooklyn Borough President's office. So we're delighted to see you all. Many of you have never been to Downstate, and we're happy to welcome you and enjoy your company and conversation. I'm going to introduce now really the mover and shaker of the conference, who's Beth Helsner. And Beth is an associate professor of epidemiology and biostatistics at the SUNY Downstate School of Public Health. She specializes in epidemiology of aging and neuroepidemiology and has research focused in those areas, but most importantly, she has an ever-expanding interest in nutrition education for the healthcare workforce and developing community-based approaches to foster and increase access to plant-based health and nutrition. So let me introduce Beth Helsner, our conference co-chair. Beth.
Thank you so much, Rich. Good morning, everybody. This is so exciting. We are delighted to have you all here. We're here today to learn about how eating a diet that's rich in whole plant foods can help prevent and even reverse some chronic diseases. We've got a fantastic day in store for you. We're going to hear from experts at the forefront of the plant-based movement. We'll hear from Brooklyn Borough President Eric Adams and his compelling testimony about how he is able to improve his own health. We're going to hear the insights and experiences of our wonderful keynote speaker, Dr. David Katz. Then we're going to hear from Dr. Rich Rosenfeld about the efforts going on now at Downstate when it comes to plant-based initiatives. After lunch, we're going to, well, first of all, lunch is very important. We're going to have a delicious plant-based lunch. After lunch, we're going to hear the story of a reformed cardiologist, Dr. Robert Ostfeld, and the evidence supporting plant-based nutrition when it comes to cardiology. Then we're going to hear about the psychology that underlies vegetarian identity. We'll wrap up the day with two wonderful panels of local experts. The first is going to discuss how best to make the transition to plant-based nutrition and how to overcome barriers to this way of eating. And the second panel is going to focus on how we can overcome institutional barriers to change and access to plant-based foods. So thank you all for coming here to learn, discuss, network, be inspired. I'm looking forward to speaking with you at lunchtime. I hope you have a wonderful day. And with that, I would like to introduce the president of SUNY Downstate, Dr. Wayne Riley.
Well, good morning. We are excited to have all of you on our campus today for a very important topic, and that's about how we can prevent disease and illness, not just treat disease and illness. So again, this initiative, the focus on improving health and prevention through plant-based diets is something that has been a long time coming in many places like this, but we at Downstate have embraced this because we know the data, we know the science, and it works. And so thank you for being here. This is very important. I want to salute Dr. Richard Rosenfeld and Dr. Elizabeth Helsner. They have been the dynamic duo to get this conference organized and programmed. So let's give them both a round of applause. Now, the next gentleman I have the honor of introducing is one of the finest public servants that I think I've ever met in my life. And I've spent some time in government before becoming a physician. And I know the sacrifices that public officials make to serve the public. And sometimes we don't recognize our public officials for the sacrifices they make. They're away from their family. Sometimes their finances go sideways because they serve us. But the gratification that you get from public service is what draws you to public service. And I can tell you that the Honorable Eric Adams is one of those types of individuals who is passionate about public service and serving our great borough of Brooklyn and New York City, New York State, and indeed the nation. And so I have been honored to get to know the borough president. He was here at my inauguration, and he spoke passionately then about how his life had been transformed by adopting a plant-based diet lifestyle. And I won't steal his thunder because he's going to give his own personal testimony. But I can tell you, as a primary care general internist, I wish I had had patients like Eric Adams, who had followed the prescription. And literally, I used to write out, exercise 3 times a week, eat less meat, less fried food. And I'd give it to my patients, and they'd chuckle and say, "Oh, Dr. Raleigh, you crazy. Just give me my medicine." So I'd give them their medicine. But I was trying to teach them with that silly little stunt of writing it on a prescription pad to try to get them to adopt a healthier lifestyle. And this great public servant, our great borough president, has done that. And so it is an honor for me to introduce him. Now, I got to tell you, New Year's Day, I've been up late with my kids and my wife. We watch the ball drop on TV and everything, and we have our toast and we eat, and then we go to bed. And so I woke up a little late on New Year's Day, and I turned on the news. There was the borough president at Coney Island getting in the water. And I said, my gosh, what does Eric not do? So there he was, bare-chested, 20 degrees, in the water in Coney Island. I said, boy, he makes us all look like slackers. So it is now my honor to introduce the great borough president for the borough of Brooklyn, the Honorable Eric Adams.
It was cold that day also, you know. This institution is a great institution, Downstate, and we are a great team. We're a great team. And for far too many years, whenever you have a team, and I use the analogy of sports to talk about, how do you move towards the championship? How do you move towards building the synergy that's needed to allow a great team to materialize their success? And you really need a marquee player. You need a player that you can build the team around, could bring the right energy. And right here in Brooklyn, we have the LeBron James of medicine and Dr. Raleigh. Dr. Raleigh is... And I don't waste your capital dollars, but when I see something come to my office about spending capital dollars to develop this institution, and it says Downstate, trust me, we are going to write the check because we know it's not going to be wasted and it's going to deal with those issues. So let me say this, and we're going to hand it off to the professionals that are here. This has been an amazing journey for me and the entire concept of wellness. And if I can, for just a moment, part of the discovery, because once you start peeling back the onion, you start going deeper and deeper. And I think what Dr. Raleigh stated really hits home. There's this concept that many of us are not aware of. Do you know that psychiatrists were the only doctors that never examined the organ they were attempting to fix? If you were a cardiologist, you looked at the heart. But psychiatrists never did that. Neuroscientists came forward, and using technology, they were able to actually look at the brain, and they partnered with psychiatrists, and they were able to see how the brain actually operates. And in the process, one part of that discovery is something that's called synaptic connections. Synaptic connections are so significant because every time we learn something new, neurons connect. And so you go from knowledge to thinking to doing to being. Being is when it becomes a habit that remains with you forever. When you wake up in the morning and you brush your teeth, you don't think about putting the toothpaste on, dampening the toothpaste and brushing your teeth. You don't think about dressing yourself, tying your tie. In fact, some of you, if you were to do a real analysis, can't even tell you what route you took to get here today because you're so used to coming here that the synaptic connections are so solid. And once you are in the state of being, the synaptic connection becomes part of you and it becomes part of a habit and you no longer have to think through it. Now, this is not a 9 o'clock biology class, but this is important. These synaptic connections, these neurons that go off in our brain, we have more electronic pulse in our brains than all of the cell phones that takes place globally daily. Those synaptic connections, learning how to ride a bike, you create these synaptic connections of balancing yourself, of pedaling, of moving. You can learn something incorrect and then learn it correctly, so you have to disengage the synaptic connection that taught you something incorrect, and you start a new synaptic connection that teaches you how to do it correctly. We don't have a healthcare problem. We have a synaptic connection problem. We were raised year after year, life after life, on our eating habits that taught us how to eat habits that is causing the diseases that's impacting us. So if you go into a hospital and Dr. Riley give you a prescription of telling you the things that you need to do to be healthy, and you're used to the synaptic connection of the fried food, of the junk food, of the McDonald's, of all those things that you need to do that you celebrated during Thanksgiving and Christmas, and grandmother gave you a recipe that you handed down to your children. You created these synaptic connections, and you went from thinking to doing to being, and now this is part of you. If we don't have in medicine methodologies to disengage the synaptic connection of unhealthy behavior and have new synaptic connections of healthy behavior, then we're not going to fix the problem. That must be built in the conversation. And what is interesting about the synaptic connection, remember, when you learn how to ride a bike, you didn't do it correctly the first time because that was only the connection. The connection becomes fostered when you do it repeatedly. Now you don't think about getting on the bike and saying, balance myself, pedal, steer. You don't think about it because you went from thinking to doing to being. So, when I was told I was diabetic, when I lost my vision in my left eye, was losing in my right, when they told me I had permanent nerve damage that was irreplaceable, when I had an ulcer, high cholesterol, high blood pressure, all of the things that I looked fine physically, but I was breaking down and I didn't take an internal selfie. When I spoke to my doctor had a synaptic connection from medical school that said, diabetes, prescription, give him insulin. So when I went to the 5 other doctors in the city, all experts, all with prestigious degrees, but they all came from a place where the synaptic connections were telling them diabetes, prescription, insulin, heart disease, prescription, statin drugs. They had a synaptic connection from their training. that only told them the way to deal with the health issue was through the prescription pad. And even if they thought you're supposed to modify some of your eating behavior, the reality was that their synaptic connection wasn't strong enough to tell them that is where the majority of our energy should go. And so if you are a nutritionist, want your patients to do better and eat better, but the reality was that even in some of the philosophies of nutrition in this country, it's about eat leaner meat, eat chicken instead. One of the highest areas that you have salt contents. It's all right to eat a few eggs. All the food that we were telling people to do was feeding the diabetes. And when the decision was made that, Eric, listen, be scientific in how you approach diabetes, go to Google and Google reversing diabetes, that's when I started the journey of reversal. And finding doctors like Dr. Esselstyn and Dr. Greger, and some of the great doctors, Dr. Katz, who's here today, finding those doctors who disengaged the synaptic connection that told us we couldn't reverse disease allowed me to disengage my synaptic connection and reestablish new synaptic connections, and was able to reverse my diabetes, reverse my blindness, reverse my nerve damage, reverse my cholesterol level, reverse my lifestyle. Not only did I go from looking good outside, but I started to heal inside. I tell people all the time, I don't have a six-pack, I have a case. My body is solid right now. But the journey didn't stop there. 79-year-old mother, 79 years of a synaptic connection of eating a Southern diet similar to the Caribbean diet, similar to the Hispanic diet, similar to the East Indian diet. All of us have these same diets. When I went to Mom and said, Mom, listen, you can turn this around. After 79 years, 15 years of being a diabetic, 7 years on insulin, 2 months after taking her synaptic connection and creating a new one, she calls me and says, baby, I'm off insulin. The doctor took me off insulin. 2 months. Where we are going is so amazing. Because not only are we healing individuals, but chronic disease hijacks your life. Every one of you in this room knows someone who is going through a chronic disease. Every one of us. Thinking about hospice care, nurturing a girlfriend through breast cancer, dealing with a family member who's going through prostate cancer. I just lost my dad 2 years ago from prostate cancer. My sister just went through breast cancer. My other sister just lost her kidney. All of us can sit back and write the biography of the family members who are going through a chronic disease. Your presence here today is part of the revolution of medicine that's taking place across this entire country. And it's starting here in the borough of Brooklyn. What we are doing is amazing. Removing processed meat from our schools, a type 1 carcinogen by the WHO. Our children, our babies are going to eat healthy. Moving towards a vision of hydroponics, showing young people how to grow food in their classroom. There's no reason that every school building in this city can't have a rooftop garden while children can grow the food and serve it in their cafeteria. Starting the plant-based program at Bellevue Hospital. This is amazing what we're doing. The oldest hospital in America has the first plant-based unit where we are going to use reversal of diseases, thanks to people like Dr. Katz and others. Bringing in our faith-based institutions. One of the most unhealthy places we assemble is in our churches, our synagogues, and our mosques, where we're talking about the beauty of God wants us to be fruitful and multiply, yet we becoming toxic and die from the food we're serving every day. Changing the game. Disengaging the synaptic connections that taught us how to eat unhealthy and be unhealthy, and reconnecting a new synaptic connection to show us how to live and how to prosper. That's what this journey is about. And I'm going to give all of me to help us at least have the information so we can make intelligent decisions. The determination of live with diabetes is over. Live with heart disease is over. Live with conditions is over. We're now moving into a new mindset, a new synaptic connection. We're moving to a direction of reversal. And all we want to do today with all of you is to just give you a new synaptic connection. And you will go from thinking to doing to being. Let's heal.
Good morning. Yeah. I'm Katao Damasey, the Dean of the School of Public Health at SUNY Downstate. So I'm here to introduce Dr. David Carr. It's with a special excitement that I introduce him. Have you wondered how to prevent disease and avoid chronic diseases and live longer? Probably you'll get the answer from Dr. David when he talks about prevention of diseases. A proper introduction of Dr. David Carr will take me a very long time. I'm sure you're here not to listen to me, so I will try to make it very brief. He is a well-recognized global expert in nutrition, weight management, and prevention of diseases. He is a founding director of Yale University's Yale Griffin Prevention Research Center, past president of the American College of Lifestyle Medicine, and founder and president of the True Health Initiatives. Dr. Carr is an exceptional and exemplary public health leader. He has served as a role model, a teacher, and a mentor for several medical students and also public health professionals throughout the United States and the world. His research has been influential in shaping public health policy, particularly in preventive medicine and also in nutrition. Dr. Carr is the recipient of many awards for his contributions to public health. He has received many honorary degrees, doctorate degrees, and he holds several US patents. He has appeared widely on radio and televisions, and probably most of you have seen him on Good Morning America on ABC News. He's widely recognized for his abilities as an orator. Dr. Carr has been praised by peers as the poet laureate of health promotion. Ladies and gentlemen, please welcome Dr. David Carr.
Good morning. Ladies and gentlemen, the borough president took us to church. I mean, really, Eric? Amen. We'll start there. Pleasure to be here. You know, there is a pleasant peril of these congregations going to the same church, and that is you wind up preaching to the congregation, right? So there's a good chance we are already a friendly audience with regard to the fundamental truth, the incontrovertible truth about lifestyle as medicine that's hiding in plain sight. But then again, Steph is notoriously good at hiding in plain sight, like that pesky elephant in the room. It was 6 men of Indistan, to learning much inclined, who went to see the elephant, though all of them were blind, that each by observation might satisfy his mind. The first approached the elephant, and happening to fall against his broad and sturdy side, at once began to bawl, "God bless me, but the elephant is very like a wall." The second, feeling of the tusk, cried, "Ho, what have we here? So very round and smooth and sharp, to me 'tis mighty clear. This wonder of an elephant is very like a spear." The third approached the animal, and happening to take the squirming trunk within his hands, thus boldly up and spake, "I see," quoth he, "the elephant is very like a," help, "snake." The fourth, folks, we're going to need some help here, reached out an eager hand and felt about the knee. "What most this wondrous beast is like is mighty plain," quoth he, "'tis clear enough the elephant is very like a tree." The fifth, who chanced to touch the ear, said, "E'en the blindest man can tell what this resembles most, deny the fact who can. This marvel of an elephant is very like a fan." The sixth no sooner had begun about the beast to grope, than seizing on the swinging tail that fell within his scope, "I see," quoth he, "the elephant is very like a rope." And so these men of Indistan disputed loud and long, each in his own opinion, exceeding stiff and strong, though each was partly in the right and all were in the wrong. So oft in theologic wars the disputants, I ween, rail on in utter ignorance of what each other mean, and prate about the elephant not one of them has seen. Now, my friends, I fear we're prone to much the same tendency in epidemiology, nutritional epidemiology in particular, and hence my mission here this morning at the Borough President's Church is to point out the elephant in the room. Here's what's on the breakfast menu. So we have looked past elephant bits. We will visit the dark wood of modern epidemiology, talk about Archimedes' levers, have some choices to consider. Okay, have recourse to a big spoon. Okay, consider the tip of the spear, listen to voices, come again to a fork in the road, and see about elephant bounds. Are there any questions at all about this perfectly clear agenda? All right, I'd best clarify. So I started out with an elephant in the room, but of course the other metaphor is the forest through the trees. It's my contention that if ever we are to escape the dark wood of modern epidemiology, we must first see the forest through the trees. And I was speaking to my good friend, Dr. Osfeld, about the fact that the very best scientists do science. And science is intrinsically reductionistic. It's how we know about things like synapses and build the technologies that can view the brain to advance psychiatry and public health, for that matter. We break things down into the smaller bits of smaller bits, but there is a risk in that. We can all honor the power of science. Everybody here who's using a smartphone, damn, those things are smart, right? I mean, we can beam our thought to any other individual on the planet instantaneously. It's almost magic. Science is practical magic. But the peril in it is the reductionism that can cause us to lose the forest for the trees. Everybody's a tree expert. We lose sight of the forest even as it burns down. We need to fix that. If we are to escape the dark wood of modern epidemiology, we will need to see the forest through the trees. And in this dark wood I speak of, chronic diseases, so eloquently described to us already this morning, are taking years from people's lives. And because they're chronic diseases, they're not just doing that. They're not just killing us prematurely. They are also first taking life from people's years. And the idea that these chronic diseases are not the causes of premature death was revealed emphatically and decisively the year I completed my training in preventive medicine at Yale. I was trained in internal medicine. I decided taking care of people after they got sick wasn't enough. I wanted to be more involved in helping keep people healthy in the first place. Trained in preventive medicine, completed that program in 1993, and this paper came out. Actual causes of death in the United States. Bill Foege and Mike McGinnis basically said in this seminal paper, the stuff that goes on death certificates written there by sleepy medical residents at 3 in the morning in the hospital about cause of death is all nonsense. It tells us nothing when someone dies of complications of a myocardial infarction to see that atherosclerotic heart disease was the cause of death. It's true, but entirely unilluminating what caused that. So McGinnis and Foege were among the first and arguably the best to get their arms around this issue, wrestled under control, and say, no, no, all of those things are effects, not causes. It's the stuff that causes that that matters, and that list is in our paper. And they enumerated a list of 10 factors that collectively accounted for virtually all of the premature deaths that occur in our country every year. And that list was fascinating. It was fascinating because those 26 years ago, everything on that list was already modifiable by knowledge in our hands and power. We had the latent potential to exercise, still mostly unrealized, by the way. And that list was fascinating because collectively it accounted for almost every premature death in the country, but for a rounding error. The power of modifiable root causes of death is extraordinary. And that list was amazing because it was compiled of things we can change as individuals or we must come together to change. Sometimes the best and sometimes the only robust defense of the human body resides with the body politic. And when that's the case, we need to come together in a church like this one and get it done. But for my purposes, in terms of the trajectory of my career, the singularly remarkable thing about McGinnis and Foege's list is that 80% of the action was clustered in just the first 3 entries on the list of 10. And those 3 entries were, in order, in 1990, tobacco, poor diet, lack of physical activity, or as I have called them my entire career, bad use of feet, forks, and fingers. Bad use of feet, forks, and fingers by themselves accounted for 80% of the premature deaths in the US as of 1990. And the only problem with this epiphany is that the vintage is getting a bit old. I suspect you convened here for fresher data than 1993. I can see it in your eyes. Okay, fair enough. Fresher data. 10 years later, Ali Maghdad and colleagues at the CDC reanalyzed this issue, reaching substantially the same conclusion. All that had really changed in the span of a decade is that the gap between tobacco as the #1 cause of premature death and the combination of bad use of feet and forks as #2 had narrowed. It had narrowed for one good reason, less smoking, and one not so good reason, deteriorating use of our feet, degenerating use of our forks, worsening epidemics of obesity and diabetes to show for it. This then was the dark wood of modern epidemiology back in 2000. The paper was published in 2004, also now an old vintage, nearly 20 years old. Let's jump ahead. 2009, and while we're at it, let's flip this coin over, look at the other face. What if people get the behaviors right? Earl Ford and colleagues reported on survey research conducted among 23,000 adults living in and around Potsdam, Germany. They asked these 23,000 people about 4 factors related to their health. They asked, do you smoke, yes or no? Do you eat well, yes or no? And we must digress there because I can see you want a definition of eating well. And I understand you expect that definition to somehow factor in coconut oil. And I certainly know that you expect it to reference both gluten and lectins. And obviously you expect it to account for whether or not a food's been genetically modified. I mean, duh. And clearly you're interested in the ratio of omega-6 to omega-3 fat, right? And I think we should differentiate among the saturated fatty acids so that we carve out stearic and lauric acid from palmitic and myristic. You clearly are expecting all of, right? Well, anyway, Ford and colleagues didn't do all of that. They defined eating well as habitual intake of vegetables, fruits, and whole grains. And it was enough. It was enough, that simplistic definition of eating well. Well, hang on. Enough for what? I'll tell you in a minute. Back to our regularly scheduled program. So they said, do you smoke, yes or no? Do you eat well, defined that simple-minded way, yes or no? Are you physically active on a regular basis, yes or no? And do you have a healthy weight, yes or no? And let's digress again for just a second, because one of these things is not quite like the others. Arguably, one of these things just doesn't belong. Did anybody in the room wake up and decide what to weigh today? Would that it were so, right? Weight is not a decision. Weight is not a choice. Weight is not a behavior. Weight is an outcome. And as a physician taking care of patients for over 25 years, I can tell you it is a fact of metabolism that two people can eat the same, exercise the same, one gets fat, one stays thin. It's not fair, but unpleasant things can happen to thin people too. That's not always fair either. Life is just like that, right? And we know some of the reasons why this is the case: variations in genes, variations in resting energy expenditure, ethnic variations, and other stuff we haven't figured out yet, but we know that it's true. And one of my concerns as we think about incentivizing healthy behavior is all too often BMI winds up on that list as if it were a behavior. It's not a behavior. You can choose whether or not to exercise. You can choose whether or not to eat well. You don't wake up and decide what to weigh today. Nobody does. Okay, end of digression 2. Back to long-suffering Dr. Ford's study. So they asked these 23,000 people, do you smoke? Do you eat well? Are you active? Do you have a healthy weight? And they went on to compare the two ends of the spectrum. So they compared, I don't smoke, I eat well, I'm active, my weight's fine, to I smoke, eat badly, don't exercise, my weight's not so good. These people, over the entire multi-year span of the study, had an 80% lesser rate of all major chronic disease than these people. Flip the switch from bad to good on any one of these factors, and the probability of developing any major chronic disease goes down about 50%. But fire on all 4 cylinders, and as best we can tell, the lifetime probability of ever developing heart disease, cancer, stroke, diabetes, dementia, the slings and arrows of modern epidemiologic misfortune is slashed. A stunning 80%. Now imagine if the news were to break tomorrow. You used to be able to say front page above the crease, but now it's on a glowing screen that we all like. So whatever website you prefer, there's a new drug available, FDA approved. It's available in bountiful supply. It is shockingly free of side effects, stunningly inexpensive, safe enough for children and octogenarians alike, and taken once daily for the rest of your life, will reduce your risk of ever getting any major chronic disease by 80%. Who would not want a prescription for that? The doctors wouldn't be able to keep up with the calls for prescriptions, except the doctors wouldn't be in their offices even to answer the phone. They'd be meeting with their broker trying to buy stock in the company selling the stuff. Because both taking that pill and owning the stock would be excellent ideas, but for the fact that there is no such pill. And in my professional opinion, there never will be any such pill. But lifestyle is exactly that medicine. And we've known about it since 1993 at least, and arguably since the insights of Hippocrates. Anyway, if you happen not to like Potsdam for some particular reason, or you're really fussy and want your data fresher still, we have reaffirmation of these findings, an 80% variance in the risk of all major chronic disease in a cohort study by Kavavic et al. A few years ago in the UK, more recently still by McCullough et al. Here in the US. And by the way, I'll be happy to share slides, so those of you who don't capture images of all the bibliography can get access to it. Otherwise, you can just email me. I'm happy to share. And I would argue that this is one of the more repetitive drumbeats in all of the peer-reviewed literature. Again and again, oh no, don't start that again, and again and again, we are reminded that a short list of lifestyle factors, effectively what we manage to do with our feet, our forks, and our fingers, could shift our medical destinies by a summative 80%. 80% less risk of all major chronic disease. And Eric, I'm routinely inclined to do exactly what you did and ask people to think about the people they love who are going through a chronic disease. And we can do this exercise. Who loves somebody who's been affected by heart disease? Show of hands. Who loves somebody who's been affected by diabetes? Show of hands. Who loves somebody affected by cancer? Show of hands. Who loves somebody affected by stroke? Show of hands. Who loves somebody affected by dementia? Show of hands. These scourges of modern epidemiology have invaded our homes. They have invaded our families. We speak in public health about statistics and epidemiology, and it can seem remote. But it's not. It's up close. It's intimate. It's personal. Imagine a world where 8 times in 10, those questions did not result in people raising their hands. 80% of us who just put our hands up would not, because those things don't happen. That world is possible. That world is within reach, if only we would grasp it. And the power of this has virtually no limits. It reverberates to our very pith and marrow, to within the double helix of DNA itself. We were giddy with the potential of genomics at the start of the genomic age, thinking that medical destiny resided there. In fact, it does not. DNA is not destiny, with very rare exceptions. Sickle cell disease, and actually some of the genetic work may fix that. Huntington's disease, rare exception. But to a largely neglected degree in our culture, dinner is destiny. And we have research to show that. So Dean Ornish, one of the leaders in lifestyle medicine, plant-based nutrition as medicine, did this study with colleagues some years ago. They enrolled 30 men with early-stage prostate cancer. We heard about prostate cancer already this morning. In its early stages, we're not sure whether or not to treat prostate cancer because it may progress, it may not, and if it doesn't, the treatment could be worse than the disease. So we do watchful waiting. Doctors carefully monitor these patients to see if the disease progresses. They treat only if it does. But Dr. Ornish and colleagues said, well, we can do better than just watch and wait. While we're doing that, let's give these men the benefit of lifestyle as medicine. And so they did. They gave them optimal plant-based nutrition, routine physical activity, obviously no tobacco, and in addition, plenty of good sleep. They helped them mitigate their stress, and they cultivated strong social interactions. And as the past president of the American College of Lifestyle Medicine, I argue that is the 6-cylinder engine of lifestyle as medicine. So plant-based nutrition is the centerpiece, but we're talking about feet, forks, fingers, sleep, stress, and love. The 6-cylinder engine of lifestyle as medicine. So they were firing on all 6 cylinders in this study. And over a span of months, the researchers went on to study not so much the men with the cancer, and not so much the cancer in the men, but preferentially the genes in the men with the cancer. And what they found is that this intervention took 500 cancer promoter genes and effectively turned them off, and 50 cancer suppressor genes shown here, and radically turned them on. Left is before, right is after, red is off, green is on. The power of lifestyle is such that it can refashion our fate at the very level of our genes. You change your behaviors, it can change the behaviors of your genes. This is a power we're only beginning to realize, and this is a branch of the literature that's filling up fast. So again, we thought DNA was destiny. Mostly it's not. Mostly dinner is, and lunch and breakfast. We even have evidence that lifestyle can alter the very architecture of our chromosomes. These green caps are telomeres. The length of our telomeres, the caps at the ends of chromosomes, arguably the single most potent predictor in all of biology of the length of healthy lifespan. Long telomeres, long healthy life. Now, other things being equal. Ill-advised, even with very long telomeres, to stand in front of moving buses and trains, for example, but other things being equal, long telomeres, long healthy life, and there is evidence, again, our friend Dr. Ornish, who turns up everywhere in the lifestyle medicine space, but also Elizabeth Blackburn, a Nobel laureate in medicine, that lifestyle interventions can lengthen telomeres. So we're starting to understand the cellular mechanisms by which lifestyle medicine is the most potent medicine ever conceived. And we know, although we cannot alter the genetic hand we're dealt, we have massive control over how that hand is played. That's called epigenetics. And before I tell you about this study very briefly, I'd like to point out to all of you that to some extent your medical destiny was shaped in the womb of your maternal grandmother. We are all a mix of genes from mother and father. Our mother was a mix of genes from her mother and father, but the genes our mother gave us formed inside our mother. They were imparted to us by her egg, which formed inside her ovary. And that egg, inside our mother's ovary, formed in the womb of our maternal grandmother. Infant girls are born with all the eggs they will ever have. The ovaries ultimately mature and deliver those eggs, but they're already there fully formed. The genes in those eggs are fully formed. And the environment of our maternal grandmother's womb exerts an influence on the epigenome in that egg. 95% of chromosomal real estate is not genes. 5% is genes, 95% is the epigenome, the levers and switches that turn genes on and off, up or down. Those levers and switches were set in our mother, in her mother's womb, and imparted to us. What a profound responsibility. There really is transmission across a sweep of generations, not just to one. Lamarck, who argued that the blacksmith's muscle should be bestowed upon his children, was a little bit right after all. Mendel was more right, Darwin was more right, Lamarck was a little bit right. Actually, our behaviors are transmissible. They influence the epigenome and we transmit that too. But here's the good news. At any moment, including at age 79, we can take control of our epigenome and reset those levers and switches. And so this study, high-risk people for heart disease, bad genes. Got a lifestyle intervention, and they outdid the bad genes, slashed their rates of cardiovascular events in half. Even if we're dealt a bad genetic hand, we can play it masterfully, we can still win the game. And winning the game doesn't mean lowering your cholesterol in 6 weeks. It doesn't mean losing 27 pounds in 22 minutes, no matter what they tell you in the infomercials. Winning the game means more years in life, more life in years. Healthy people have more fun. That's winning the game. So I make the case, hope I have, that the master levers of medical destiny are not the tools of the medical trade, not the stethoscope we docs carry across our shoulders through the corridors of hospitals, nor anything at the cutting edge of technological advance, not PET or SPECT or fMRI. The master levers of medical destiny were in our hands all along. They're what we manage to do every day with our feet, our forks, and our fingers. And I trust you know what Archimedes said about a lever. Give me one long enough, I can move the whole world. Make no mistake, these levers are long enough and should long since have served to move the whole world of modern epidemiology and public health to a better place. But, alas, we like to say knowledge is power. Would that it were so. Knowledge is necessary for power. Knowledge is prerequisite for power. Knowledge is not commensurate with power until we use it. And the gap between what we know, indeed what we have long known, and what we do with what we know belies the wishful thinking that knowledge is power. And so a luminous opportunity to add years to lives and life to years has been squandered this quarter century and more. Not lost in translation, but lost in want of translation, the failure to take what we know and turn it into what we do routinely. And folks, it is a privilege to come to a place like Brooklyn where that will exists, to work together, to mobilize the body politic, to turn the promise of knowledge into power at last. It is long overdue, and we have been reaping the whirlwind. When knowledge isn't power, things do not improve. In fact, they tend to go south. And so all these years since McGinnis and Fige's memo, we have been watching rising rates, not falling, of chronic disease, rising rates of obesity in the US and around the world. This paper, The Global Burden of Disease Focused on the US, tells us that with the most recent data, the single leading cause of premature death in the United States is food. This thing that should sustain us, this thing that should nourish and nurture us, The construction material for the growing bodies of children and grandchildren we love is killing us. It's really quite a travesty. And despite all we know about how to control weight by eating well and being active, rates of obesity just continue to rise. This is the latest color-coded map from the CDC, with red representing a prevalence of obesity greater than 30%. They had to introduce this color just in the most recent map. Gives a whole new meaning to red state. And not so good. And by the way, there is considerable overlap, but that's a topic. I'll defer that one to the politicians. Moving on quickly. What is the problem? Why all these years has knowledge not been power? Well, I think arguably you could say if you take this, Homo sapiens in their native habitat, and you add this, the modern foodscape as it were, you pretty much inevitably get this. You've noticed the pause. I've learned to anticipate 2-beat appreciation for this slide, so I'll wait for that second beat before I move on. In much the same way as if we took this and added this, we would get this. And I give you my figurative trademark for more than 25 years, the polar bear in the Sahara. I note hastily that when my wife, who's sitting right here, and I put this slide together 25 years ago, there was no imminent threat of this actually happening to polar bears, and alas, that has changed. So our point was not climate change here. I'll come back to climate change before I'm done. Our point was adaptation. Polar bears are marvels of survival, but beautifully adapted to just one particular habitat, and that is a cold habitat. And the very traits and tendencies that foster their survival in the cold would conspire against them, as indeed they're doing, as things warm up. You retain warmth where it's scarce, it keeps you alive. You do the same beneath the burning Sahara sun in summer, and it cooks your goose. And my point in this slide is that we are polar bears in the Sahara. Throughout most of human history, calories were relatively scarce and hard to get, and physical activity was unavoidable. It did not require gym membership or specialized footwear. It was called survival, and everybody just did it every day. We have devised a modern world where physical activity is scarce and hard to get, and calories are unavoidable. Houston, we have a problem, and Brooklyn, and every place in between. I submit to you that as a species, we have no native defenses against caloric excess or the lure of the couch, never having needed them before. No native defenses, that is, save one: great big Homo sapien brains. We are, arguably, smarter than the average bear and can think our way out of this mess of our own devising. And that's just what we need to do. As we begin that job, I think we find that immediately the problem fractures into 2 component problems. The first is, it may seem such a mess, this land of golden arches, where multicolored marshmallows masquerade as part of a complete breakfast. It may seem you just can't get there from here. I would argue we can. One step at a time, one sandbag in a levee to control the rising tides of toxic tribulation at a time. We can get there from here. And in some other talk at some other time, I'll talk to you about all those steps. But for now, I want to spend time on the other component problem, and that is, we will never get there from here if we don't know where there is. Now again, I realize this congregation knows where there is. That's why you're here. You're here because you know where there is. I got that, okay? But we must all go out and preach the gospel. And we must preach the gospel predicated on both our native sense and the relevant science, because we must be persuasive. We must win converts. We will never get there from here if we can't agree we know where there is. Now, with regard to fingers, not much argument. Smoking is bad, not smoking is better. Any dissent? See how easy that is? With regard to feet, generally little dissent there too. Using them good, staying on our rear ends all day long, not so much for the most part. Movement is good. Any disagreement? But when we come to forks, there's the rub. Because even in this audience, if I went around the room, there'd be different theories about things like the importance of gluten or lectins, or which vegetables are better than which others, and how much fructose actually matters, and all of that. Even here, Even in our congregation, there would be dissent. And out there in the world, damn, it's so much worse. Basically, the public says, well, hey, we don't know anything. Because you know what? I heard on the Today Show that somebody just came along and threw all you guys under the bus. And everything we thought we knew up until yesterday is wrong. Again, until tomorrow, when somebody comes to throw this guy under the bus. And around we go, getting nowhere, acting as if we don't know where there is, and leading most people to ask this time-honored question: what to trust about food? What'd y'all think? And bringing us to a fork in the road. Along one time, we remain forever befuddled about the basic care and feeding of Homo sapiens, and I'd like to propose the alternative road. I've devoted my career to this. I won't belabor it, but books, including my most recent, textbooks, articles, making the case that the truth is hiding in plain sight. I'm in the excellent company of people like Darius Mosafarian, Dean of the Friedman School of Nutrition at Tufts, Jim Mann at the University of Auckland, Frank Hugh, who chairs nutrition at Harvard, and many, many others. If you look without bias at arguments for or against low-fat diets and vegan diets and low-glycemic diets and the DASH diet and the diabetes prevention program and paleo and low-carb and Mediterranean, our culture runs on the dialogue that one of these is better than the others today. Wait until tomorrow. My diet can beat your diet. And we bicker and make no progress. And the reality is the olive in the middle. Nicely skewered by Michael Pollan when he said, eat food, not too much, mostly plants. And although that leaves quite a bit to the imagination, in the generalities, it is fundamentally correct. Real, wholesome food, plant predominant. Plant exclusive, fine, not necessary for everybody, but let's just get everybody moving in the right direction. Let's not make perfect the enemy of good. And frankly, much the same conclusion in the 572 pages of the 2015 Dietary Guidelines Advisory Committee report. Yes, it's true. Pithy Michael Pollan got it down to 7 words. This was 572 pages. But no offense, Borough President, this is government work. What are you going to do, right? We actually reached much the same conclusion in 2015 when Old Ways sponsored a Common Ground conference I was privileged to co-chair with Walter Willett in Boston. We convened disagreeing nutrition experts from all around the world, Mediterranean, paleo, vegan, and over a few days we mapped out the common ground and decided we agree about 80 to 90% of everything. It's just that when you put a microphone in front of us, all we ever talk about is our disagreements. I'm right, they're wrong. Listen to me now. We got to stop doing that, right? We mostly agree. And I knew that because I'd had lunch with these characters, and I said, hey, everybody's eating most of the same stuff. That matters. Let's tell people. Oh, and by the way, this idea that we've got to pick one scapegoat, right? So, you know, sugar's bad now, so saturated fat must be good. Nonsense. No, sorry, folks. Are there Mark Hyman fans in the audience? Apologies, but Dr. Hyman did not singularly discover the harms of sugar in his garage last Wednesday. We've actually known for 40 years that excess sugar is harmful. There have only been dietary guidelines in the U.S. since 1980. These were those, 1980, 7 bullets, number 5, avoid too much sugar. We've been delivering the memo for decades. It's just that nobody is bothering to read it. They're too busy eating multicolored marshmallows as part of their complete breakfast or something. Oh, and by the way, this whole pop culture narrative, this might be Gary Taubes. You know, we cut fat and got fatter and sicker, so we picked the wrong macronutrient. We need to cut carbs now. Also, nonsense for many, many reasons. One of which is everything from lentils to lollipops is carbohydrate. How can you pass summary judgment on that vast expanse of the foodscape? But we never cut fat in the first place. You know, there are 2 ways to cut fat as a % of calories. There is the sensible way that might actually help people, and there's the American way. You know, so, you know, in the sensible way, you would actually eat a bit less fatty food. America, we don't like less. Less is bad. It's a bad concept. More. We like more. So we went that way. And if you want to reduce the % of calories you get from fat, all you need to do is keep eating the same amount of fat and eat a lot more of everything else. Do the math. You grow the denominator, right? You guys, math is that good, right? You can either shrink the numerator, grow the denominator. We grew the denominator. These are data for dietary intake trends for the past 40 years or so. Total intake of fat actually went up. but total intake of refined carbohydrate, added sugar went up more. So calories went up more than fat. Fat as a percent of calories went down. But folks, here's what it tells us. We were eating more of everything, and then we carry on as if the ongoing obesity epidemic is some mystery that requires more biochemical and epigenetic insights. Hello? We're eating more of everything. And we eat, this is great. This is a flow diagram. Just Google America Diet Changes Vox. Not necessarily right now. I'd rather you pay attention to me. But at some point, when you're not paying attention to me, Google America Diet Changes Vox. You'll pull up this flow diagram. It'll show you the shifts in food intake over the past 40 years in the U.S. It's very illuminating. But what I was going to say is we even know why. Michael Moss, author of Salt, Sugar, Fat, wrote this New York Times Magazine cover story, The Extraordinary Science of Addictive Junk Food. He's not the first to give us this news, but he's a Pulitzer Prize winner and he does it beautifully. What he tells us is that every major food company in the US and around the world hires teams of PhDs, gives them those functional MRI machines we use to look at brains, and marching orders to design food we can't stop eating. Unfortunately, synaptic connections can be exploited, and big food is in the business of doing just that. These guys are instructed to design food people cannot stop eating until their arm gets tired from lifting it to their mouths. And again, then we, the docs, give our patients advice about portion control and send them out into this world. And this is why I would argue we need enlightened leaders like the borough president here, people who say we've got to work together on this. This is an unfair challenge for the individual. So we know why we've been eating more. As we reflect on solutions, some people would argue this is the elephant in the room. We need to think about the Stone Age. We need to think about our Paleolithic origins. Mostly the paleo diet argument has become an excuse to eat pastrami and bacon. And folks, I've got news for you. There was no Paleolithic pastrami. Right? I never see it used as an excuse to walk 12 miles every day and eat 100 grams of fiber, which, by the way, the true experts in paleo tell us we ate 100 grams of fiber. My guess is that the paleo people doing all the opining in the blogosphere wouldn't have time to do all the opining in the blogosphere if they ate 100 grams of fiber in the day because they'd be in the bathroom. So they're not interested in that. Back to the pastrami. But there is utility in thinking about the Stone Age. We are creatures like all others, like that polar bear of mine. We are adapted to a native habitat. So what the Stone Age teaches us is that we are constitutional omnivores. Adaptationally, physiologically, metabolically, we are omnivorous. We can thrive eating plants or animals. Now, our Stone Age ancestors hunted and ate wild animals who in turn ate wild plants. We clearly are adapted to digest meat. Other animals aren't. I have a horse. My horse cannot eat meat. There are animals that must. Lions are obligate carnivores. We're in between. We have choices. This discussion, my friends, is about good choices. Being good people to one another, to the world, to our communities, to our own bodies, who make good choices. So we have choices for dietary fat. What do we know? This study out of Harvard shows the higher the percent of total calories from saturated fat from the usual sources, meat, processed meat, dairy, processed dairy, the higher the rate of premature death from all causes. The higher the percentage of fat from unsaturated sources, mostly nuts, seeds, olives, avocados, fish and seafood, the lower the rate of premature death from all causes. That's pretty stark. This is in over 100,000 people followed for 30 years. And yet we wind up here again and again with the argument that saturated fat is good for us now, butter is back. Is it really? No, it is not. I won't spend the time to belabor this issue. You can ask me about it in the Q&A if you want more. But basically, the two meta-analyses that are the foundation for the argument that saturated fat is good for us now showed that across a relatively high and relatively narrow range of saturated fat intake, rates of heart disease were high and constant. Therefore, saturated fat is good for us now. No, not so fast. It implied something to me. Maybe there's more than one way to eat badly, and Americans are committed to exploring them all. And in fact, that's exactly what's going on. When we cut saturated fat in this culture, we're not loading up on broccoli and lentils. For crying out loud, we ate low-fat junk food like Snackwell cookies. So thank goodness Lee and colleagues at Harvard came along and said, let's look at this. What happens when people cut saturated fat? Well, if they cut those calories and replace them with Snackwells, sugar and refined carbohydrate, lateral move. 2 ways of eating badly, 2 ways of having lots of heart disease. If they replace saturated fat with trans fat calories, they stop eating butter, start eating stick margarine, things go from bad to worse, frying pan to fire. But if they replace saturated fat calories with whole grain calories, massive reduction in heart disease risk. And if they replace saturated fat calories with unsaturated fat calories from nuts and seeds, olives, avocado, massive reduction in heart disease risk. No, saturated fat is not good for us now. And no, all carbohydrate is not created equal. But we all know that, right? Lentils to lollipops, pinto beans to jelly beans. Summary judgment about carbs is just so much pop culture nonsense. It's got to stop. We need to be talking about foods, as I suspect all of us do, not macronutrients. It's just not helpful. We have choices for protein. Again, 100,000 people, 30 years. The higher the intake of protein from animal sources, the higher the rate of premature death from all causes. The higher the percent of protein calories from plant sources, beans and lentils in particular, the lower the rate of premature death from all causes. And here we see that in a somewhat more granular fashion. Just scan down the list, bottom line. Biggest reduction, this is women, heart disease, biggest reduction, substituting beans for beef. And by the way, in the past year, a study out of, well, a little more than a year ago now, Loma Linda suggested that if the average American would routinely eat beans in the place of beef, just that, we could achieve roughly 60% of the greenhouse gas emissions reductions pledged in the Paris Accord. Yes, we need responsible government action, but sometimes, my friends, the power is right in our hands and in our kitchens. We can take action ourselves. We have choices for preserving our aquifers. We heard a lot about this during the peak of California's drought. Off the charts in terms of water utilization is beef. A thirsty world must consume less beef, period, end of story. And so I'm making the case, as we think about the power of plant-based nutrition for health, that we also must project beyond the limits of our own skin and think about this world we're in. In fact, let me pause here now. I'm in a school of public health. I'm honored to be here today. I don't know if you need my invitation or not, my fellow health professionals, but on the chance you do, let me issue it. You cannot call yourself a health professional in 2019 if you are not advocating forcefully, emphatically, and every chance you get for the health of the planet. There is no public health left to protect on a ravaged planet. It is our patient too. Okay, so we need to protect our aquifers. We have choices for the climate. Again, massive reduction in greenhouse gas emissions possible with a shift to plant-based eating. I love this piece in The Conversation, a couple years old now, but still good. Meat may or may not be a complex health issue. Most of us think it's not, but they said it was. Okay, fine, but it's a simple environmental one. The world needs to eat less of it. We have choices for the economy. This was just out. Group at Tufts, including Darius Mozafarian, cost effectiveness of financial incentives encouraging people to eat more plants, massive reductions in the expenditures through Medicaid and Medicare. We scientists need to do the work that empowers enlightened leaders, like the borough president here, so they can make the economic argument for investing in plant-based nutrition and lifestyle transformation. It's not just good for people and good for the planet, it's good business too. Everybody can win here. And there was a bigger analysis a few years ago out of Oxford showing savings to the tune of many trillions of dollars over a time horizon of a decade and longer if we were to shift the world's dietary patterns to more plant-based eating. We have choices for biodiversity. We are ruining fragile ecosystems, cutting down rainforests to grow palm plantations for palm oil in Borneo, cutting them down to graze cattle in the Amazon. And I don't know about you, but I don't want to be the person whose processed snack is the reason the last orangutan no longer has a tree to climb. These are the things we're doing. These are the implications of our dietary choices. And we have the choice of a grand confluence, eating better for the sake of ourselves and the planet. It's all one thing, and this was beautifully encapsulated in the recently announced Eat Lancet Commission. That was their conclusion. The same fundamentals of a healthy diet for people are good for the planet and vice versa. And yet, we do find ourselves mired here. This is the typical American diet from the book Hungry Planet, What the World Eats. And so the question in these last few minutes as we sprint to the finish line is, okay, fine. Whoops. lifestyle is the best of all possible medicine, with plant-based nutrition as the centerpiece. How on earth do we at last get the medicine to go down? Lord knows the last thing we need is more spoons full of sugar. But we need some kind of spoon to get this dang medicine to go down. It can't look like this, and this is the status quo. I told you about the work of Michael Moss. The good guys are bailing a sinking ship with pipettes. The bad guys are flooding it with a fire hose. And folks, how many of you are parents? Grandparents? Aunts or uncles? Know a kid? I'd like us all to be in on this. I want to ask you another question. So, health professionals advocate for the planet. It is your duty. Here's another one. Be outraged. Where is the outrage? When we hear in a New York Times Magazine cover story that our food supply is willfully manipulated to make people fat and diabetic for the profit of big companies, where the hell is the massive outrage among loving parents and grandparents? Because when lovingparentsandgrandparents.org becomes a special interest group, I pity the fool that gets in our way, right? We could be the greatest special interest group the world has ever known. But it is time, past time, for outrage. We know how important it is to eat well. We have rigged the food supply, making it damn near impossible to do. I don't see nearly enough outrage. Righteous indignation, my friend. So I invite you to advocate for the planet, and I invite you to be outraged. Join me. I'm outraged all the time. And I mean all this very literally. These were the new kids cereals introduced in 2017. We're wringing our hands about epidemic type 2 diabetes in kids, and corporate America is responding with sprinkled donut crunch. Be outraged. It's time. The solution we need looks less like the status quo, more like this. We got to the moon for 3 reasons, so far as I know. We wanted to go. We're an ingenious and relentless species, and we all agreed where to find the damn thing. I think we want to go to a world where there's 80% less chronic disease. We're still ingenious and relentless. I think agreeing on where there is a crucial missing piece of this puzzle. And I think it's also time to recognize we're asking too much of individuals. The big spoon is culture. Lifestyle's the medicine. Culture is the spoon. Yes, doctors can issue prescriptions, but we really need neighborhoods and communities and a culture that fosters healthy living as the norm. And we have evidence of culture as the big spoon in the world's blue zones, where people routinely live to be 100 and don't get chronic disease. They eat well, they're active, they tend not to smoke, they sleep enough, they're not stressed out, and they have a strong sense of community in these 5 sites around the world. But it's because it's normal. It's not because individuals are overcoming the currents of their culture. It's because the currents of their cultures in Ikaria, Greece, Sardinia, Italy, Loma Linda, California, Okinawa, Japan, and the Nicoya Peninsula in Costa Rica flow towards health, not away. And we see the same thing in the Bolivian Amazon, where the Chamani have the cleanest coronary arteries known to science. And we even do know, Borough President, that blue zones can be converted to blueprints and transplanted. North Karelia, Finland had the highest rates of premature heart disease and death from it in the world. In the middle of the 20th century, they learned the lessons of the 7 country study. They reformed diet and lifestyle. They reduced heart disease rates by over 82%. They added 10 years to average life expectancy. One of the most stunning achievements in the history of modern public health. We could do this. We should do this. We've been waiting too long. So, lifestyle's the medicine, culture is the spoon, but yes, we healthcare professionals want to be at the tip of the spoon, or spear, and leading the effort, and I think there are new ways to do that. And again, I'll get to the end here momentarily, but I'd like to point out one contribution in this space. Let's acknowledge that we tend only ever to manage what we measure. We should measure what matters. And frankly, diet matters most. So blood pressure is important to health. Imagine all this talk about blood pressure and never measuring it. Well, of course we measure it. And we know that glucose is really important to health for people with impaired glucose metabolism, and it would be silly not to measure that and track it. And fitness is important to people's health, so of course, we are very interested these days in measuring fitness. But the single most important variable in the health equation in the modern world is diet, and we just about never measure it. How many of you have completed a food frequency questionnaire or a 7-day food diary? Small minority in an audience of people attending a nutrition conference. In the world outside, it's virtually nobody, and with good reason, right? These damn things make your eyeballs catch fire, don't they? I mean, if we got up close to those of you who just raised your hand, we would see that your eyelashes are singed, right? I mean, you know, it just goes on and on. It's tedious. And, well, we need to fix that. We need to take a page from Matt Damon. You all see The Martian? He's stranded alone. Spoiler alert, he's stranded alone on Mars. He's an engineer. He's up there stuck, and he's talking to his video diary. And he says, so I can come to the conclusion that, and you expect him to say, I'm going to die cold and alone up here. But instead he says, and forgive me, I quote, I'm going to have to science the shit out of this. And well, frankly, you know, to some extent, our excesses in engineering got us into this messed up modern world. We need the same kind of ingenuity to get us out. And we certainly ought to be able to measure what matters in 2019. I've launched a startup company called Diet ID to reinvent dietary assessment, tracking, and coaching to help in that enterprise. And so we borrowed from a phoropter, this device you use when you go to the eye doctor. They ask you which image is clear, which is blurry. You've all played this game. And you pick and you pick and you pick again, and 30 seconds later, they don't guess at your prescription. They've got an exact match for your eyes. We do that with diet. We have a fully realized library of dietary prototypes. We say which of these looks like you after we know a little bit about you. We say pick and pick and pick again. And within 30 seconds, we know your diet type, down to the specific levels of nutrients and the 2015 HEI score, so objective measures of diet quality. We help people find a goal diet. We help navigate them from here to there. I'm not selling this to you. It's a B2B. I'm just making you aware these kinds of innovations are possible, should happen, and we can change the world. But the single most important thing to do is to rally around these fundamental truths hiding in plain sight. And I'd like to ask you to join this congregation too. I founded the True Health Initiative. It's a federally authorized 501c3 to bring together the fractious voices in lifestyle nutrition to tell the world what most of the experts already know but the public doesn't, and that is across the divide from vegan to paleo, we agree more than we disagree. You go to a conference with actual experts. The vegans have a plate full of greens and lentils or beans for protein. The paleo experts have the same greens and maybe wild salmon or maybe bison. But their plates look more like one another than either looks like the typical glow-in-the-dark American food plate, and the public deserves to know that too. So the True Health Initiative is predicated on the work of an illustrious colleague. He wrote a case report about a pachyderm with extraordinary auditory acuity or uncompensated schizophrenia. We've never really known which, but Horton could hear who's that nobody else could hear until the who's all came together and said, we are here. In the case of the True Health Initiative, we have 500 world-leading experts from over 40 countries coming together not to say we are here, but to say we agree. Because I think it's time to generate a signal that can be heard above the noise. And if you agree, please check out truehealthinitiative.org, add your voice, join the chorus. In unity, there is strength. My latest book, The Truth About Food, which covers all these things I'm talking about, is written in the service of the True Health Initiative. All proceeds from the book go to support the True Health Initiative, so you may want to check that out as well. Truth About Food, Why Pandas Eat Bamboo and People Get Bamboozled. And that brings us to the final fork in the road. For far too long, we have let health languish in our culture along the road less traveled. For far too long, we have let squander a luminous opportunity in want of translation. It's an honor and a privilege to be with you here this morning in Brooklyn, because we must come together to generate the strength born of unity, to take at last the road less traveled, add years to lives, add life to years, save the planet. And when we do all of that, the elephant in the room still won't be able to fly, but will look like this. Thank you all very much. Thank you.
Thank you, everyone. And now we have some time for to take some questions from the audience.
Thank you, Dr. Katz. Can we please have the last slide that had his email? It just flashed on and it went off in 2 seconds, please.
I'm too easy to find, to be honest, but it's pretty straightforward. So david.katz@yale.edu. And by the way, let me warn you in advance. You'll get an auto response that says something along the lines of, I can't answer every email. I'll probably answer you. I try. I really do try.
Good morning. Thank you so much for the great presentation. So you spoke on it a little bit about our argument, and we need to kind of get together, but novel and new and arguing is fun to look at. So it's something that we continue to get, that's a problem. So I just wonder how you can speak to that, because I think that's, it keeps it interesting for people, and that's why it's sustained for the public.
Yeah, no, it's an extremely important point. So I worked for 2.5 years on air for Good Morning America, and it's a poorly kept secret in broadcast media that the mantra in the control room is comfort the afflicted, afflict the comfortable. So, it is not the purpose of Good Morning America or the Today Show or People magazine to educate you. It is their purpose to titillate you. And in fact, the more often they can refute today what they told you yesterday so you buy another copy and tune in tomorrow, the better. So on the one hand, this does require ongoing efforts between the health professions and the media. We need to offer to train them in understanding how science works. No, you really shouldn't make a whole lot of noise about every study as if it refutes everything we knew up until yesterday. Science is incremental. You should remind people, this adds to what we knew. Here's someone to tell us what they think it means in context. Invite those experts. Make sure you land in a sensible place. Make sure even if you titillate and tease at the beginning of the piece, you end with something that makes sense of it. So there is a need for us to collaborate. On the other hand, ultimately, you could pose exactly this question you're posing about media, about the food supply, right? We could say, people like salty food, and they like sweet food, and they like fatty food, and they're giving us what we want. Well, that's true, but there are two issues in play. First, they help to create what we want. So we have a culture where we've created this desire for titillation in our news rather than news in our news. We could decide it's time to change our tastes. A movement begins with a small group of thoughtful and committed citizens, right? Margaret Mead, never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, nothing else ever has, with the possible exception of large asteroids. But we could change our taste for media, right? And we could say, no, actually, we're going to start tuning out the stuff that gives us titillation and overhypes things, and looking for media that deliver well-considered information. This study doesn't change everything. Here's how to interpret in context. The other thing to note is that maybe diet needs to come off that list. I've been one of the judges for U.S. News and World Report for the annual Best Diet Contest for the past decade. And I play, but every year I also tell the editors there, you do realize those places around the world where people actually eat well, they are not waiting for news about the best diet every year. They eat the way their parents ate, who ate the way their parents ate. Right? The blue zones, they've been eating the same way for generations. Diet does not need to be news every day. And then my final component to your answer is, okay, if we still want diet to be news because there's such fascination, let's have the news be how rather than what. So we all know now what is a healthy diet. It's incontrovertible, it's incontestable, everybody agrees. How do you get there from here? Today, we have another expert on to talk about culinary tips and culinary medicine and what's happening in medical schools and how you can engage children and what should be happening in secondary school and on, the how. Let's have endless stories about the how. Really cool stories about the how, and let's hear from individuals who've used the power of diet and lifestyle to transform life. The borough president story, I mean, that's great media right there, right? I mean, that was fantastic. Well, there are a lot of people like him out there who can tell their stories. So here's what it can do for you, and now let's talk about how, right? Let's shift the narrative. We do not have to listen to nonsense just because there's nonsense to be heard.
So, Yeah, first of all, thank you. That was beyond fabulous.
Thank you so much.
We really appreciate it.
Thank you.
Rich Rosenfeld, and the question I have for you is this. You alluded to the congregation who's here, and it's sort of like when you send out satisfaction surveys in a medical office, and you get a note back saying, why is it that the only offices that send these out are the ones who don't need to? You know? It's sort of fish discover, water last. And we have a conference here. We're blessed. We have close to 250 people coming. If you look at the registration, we have 30, 40 medical students, which is great.
Yes, it is.
Lots of folks from the community. And last time I checked, there were 3 resident physicians. We have, I think, 20 residency training programs at Downstate with about 800 residents. And this has been promoted, and 3, and 1 from my department, maybe 4, have found a way to come today. I promoted it to the chairs of medicine, to family practice, to others. Some of them are here, but very few practicing physicians who can't take time off from their busy day to come hear talks like this. So how do we crack that nut? It's great that we're all here, and the choir's here, and the congregation's here, but how do we get it to the mainstream, the people that really need to absorb the message?
Yeah. So first of all, thank you again for convening us. Thank you for inviting me. Excellent question. I'd like to speak up in defense of those medical residents, which I probably don't need to do because the docs in the room are all on their side. So we've all been there. You know, I mean, those guys are working 100 hours a week. If they can spend a few minutes napping, they should probably spend a few minutes napping, right? So, I mean, you know, we have to fit this in where it works best. So a few answers. And I realize the question is both real and rhetorical. You're just sort of throwing it out there. This is our problem. We wind up getting together with members of our own congregation. We preach a gospel. We share. We all say amen. But have we converted anybody? Have we changed the world? So first, this must be culture-wide. We need to acknowledge that the burden cannot be preferentially on healthcare professionals. We cannot live in a culture where big food profits massively by making people fat and sick and expect doctors in moments of clinical counseling or other health professionals to fix it. In the blue zones, where people routinely live to be 100, where food is medicine, where they don't get chronic disease, and where at the age of 102 they go gentle into that good night because they go to sleep one night and just don't wake up the next morning, they never go to the ICU. In the blue zones, you ask them how they got there, nobody says, my doctor gave me great counseling. They don't even know how they got there. They just floated in the currents of their culture their whole lives, right? So it must be culture-wide. The education should begin in preschool, in Head Start. We should be serving good food there and talking about it. The education must extend into kindergarten. We developed years ago at the Prevention Center a program called Nutrition Detectives. It was for elementary school kids. It taught them how to differentiate good from bad food, essentially, to make it simple. Using a food label, we taught them 5 clues that fit on a refrigerator magnet. We did a randomized trial in 1,200 families. The kids who got this 90-minute program, 90 minutes out of a whole school year, and we gave it away for free, by the way. Kids who got the program, massive improvement in their food label literacy and their attitude. They, you know, instead of pulling on mom's elbow and saying, I want the one with SpongeBob on the cover, they would pull mom's elbow and say, no, this has partially hydrogenated oil, put it back. I mean, really quite. But what we found in this randomized trial, published in the Journal of School Health, by the way, is that the kids were effective vectors. We never talked to their parents. We just infected their offspring with the knowledge, but the kids took it home and infected their parents. We did before and after testing in the parents of the kids who either got the program or didn't. The parents of the kids who got Nutrition Detectives had a massive improvement in their food label literacy. So kids are powerful agents of change. We need to do this in kindergarten, elementary school. Then we need peer-to-peer educational programs for older kids. Health Corps, Mehmet Oz's program in high schools, teaches good nutrition using peer mentors. We need more programs in colleges. There's a real great movement. Ken Toog at UMass is in the vanguard of this. Basically, culinary directors at colleges and universities who say, we've got a captive audience. We've got young people who aren't yet parents but are going to be, that are getting all their meals from us. We can both feed them great stuff and teach them why it's great stuff while we've got them. And when they leave here, they'll have a whole host of new synaptic connections. They will have reprogrammed their thinking about nutrition. Huge opportunity. And then at the level of those of us who are already out in the world, well, yeah, I mean, clearly we need transformation of health professional education too. That's happening. I'm really excited about culinary medicine. David Eisenberg, the work of many others, Tim Harlan at Tulane. But these programs that say, no, you can't teach doctors nutritional biochemistry and expect them to be able to counsel patients. You need to teach them good recipes they can make and eat. And then they can take that kind of information and pay it forward. That needs to happen too. But ultimately, I think what we need to say is we're all in this together, we all care, and it really does become a force for cultural change. And I do think one of the key impediments, one of the reasons we're not seeing more and more programming with good information is because there's so much debate about what constitutes good information. And that is factitious debate. That is distraction, that is diversion, that is squandered resources. And so I submit to you as one of the potential remedies there, the True Health Initiative. We need an organization that can pull us together. One of the things I wanted to do there was make sure everybody's hero was represented. So on the Council of Directors, we have 3 former Surgeons General of the United States. We have household names like Sanjay Gupta. We have famous chefs like Alice Waters. But perhaps most importantly, we have the world's leading vegan experts. So everybody who's been mentioned here this morning, Greger and Esselstyn and Ornish and all the others. But on the same panel, willing to say in public, we agree with those guys, are the world's leading experts on the paleo diet. Lauren Cordain, Mel Conner, Boyd Eaton, standing arm in arm with their vegan colleagues saying we agree more than we disagree. I think that's a potential game changer. We're working to reach 3 audiences through the True Health Initiative: health professionals, the media, as I agree with you, crucial, right? So, you know, instead of all of these he said this, she said that pieces, we're looking to the day when at the end of that article or at the end of that piece they say, so we asked the True Health Initiative, a global aggregation of world's leading experts from many different perspectives and disciplines, and they had this fundamental truth to share, right? I'd like to get us there and the general public, because the general public obviously constitutes the source of political will to make all these other things happen. So a long answer to a good rhetorical question. Thank you. So I just imagine people kind of think, all right, this guy probably thinks he's smart. I'm going to ask a question I know he can't answer. I'm going to ask a question I know nobody could answer, make him look like a giant doofus, and then he can say thank you and goodbye. So, you know, I mean, it's the 64 million, billion, trillion dollar question, and the answer is there are many, many answers. So, you know, if we want to teach people to cook, we need to make it fun and engaging, and frankly, we have all sorts of ways to do that now. It's a digital world. One of the great barriers in our work over the years at the Prevention Center has been reaching people, getting them together, you know, being where they are. But, you know, now where people are is Facebook and Instagram, and there are whole new ways to reach people with information and fit it into their digital lives. Recipes, vignettes, videos, they're wonderful tools. Not to be self-promoting, but my wife, who's a brilliant cook, grew up in southern France. Basically, at one point, one of our kids coaxed her into turning all of the Katz Family greatest hits into a free recipe site, Cuisinicity.com. Everything we eat at home, Cuisinicity.com, like Cuisine City, but with an I in the middle, Cuisinicity.com. We just paid it all forward, and Catherine's done a magnificent job of not just posting all these great recipes, but filming herself making them in the kitchen, showing you, here's how you do it. It's simple, it's fun, it's engaging. Some of them are oriented toward kids. So it's a great resource. There are others like it, but Cuisinicity.com. These culinary medicine programs are teaching people how to cook at mid-career. It's a CME program. Basically, doctors can get continuing medical education credit learning how to cook great recipes. I could go on and on. There are many components. The cost issue. First, Diabetes is expensive. Obesity is expensive. And a ruined planet is really expensive. So we are not looking at the real costs of eating well versus eating badly, either for individuals. So there are people who will claim I can't afford fruits and vegetables, but I can't afford the copay to my endocrinologist for the rest of my life. They're wrong, right? So, we need a reality check there. We also need a correction in the farm bill, which ought to be a food bill, so we're subsidizing the right foods. There are also creative engineered solutions for people who can afford better food, but maybe are too busy to take the time to cook. We can send curated meal kits to their homes. There are more and more interesting opportunities in that space. And there's even really exciting stuff going on in the world of cookery. Brava is a smart oven. You can check out Brava. Just Google Brava ovens. You can upload recipes from, now again, not everybody can afford this, but here's my fantasy. Third-party payers would pay to put this oven in the home of somebody for whom food should be medicine, but who can't afford it because it's less expensive than all those trips to the endocrinologist. This oven will accept uploads from your smartphone. You put all the foods for a recipe on a single tray, press one button. It will cook multiple foods at different temperatures in half the time simultaneously. So we can look to technological advances, and we can look to connect the dots so that third-party payers say, yes, food is medicine. We will start thinking about using the equipment that can get people there from here the way we use medical equipment now, right? So no one short, discrete, simple answer to your question, but if we committed to it, could we crack this nut? Hell yeah, we could. Thank you.
Thank you, Dr. Katz. That was fantastic. Thank you. So next up, we have Dr. Richard Rosenfeld. Dr. Rosenfeld is Distinguished Professor and Chairman of Otolaryngology at SUNY Downstate Medical Center, where he's also Program Director for Residency Training and President of the Medical and Dental Staff. He is the founder and chair of SUNY Downstate's Committee on Plant-Based Health and Nutrition and also the Vice Chair of SUNY Distinguished Academy. Dr. Rosenfeld.
Glad I got up early and worked out in case I got to do the contortionist things to advance the slides, but I think we're past that. So I'm in the really enviable position of, one, speaking after two of the best speakers you've probably ever heard, right? And three, being the only thing between you and plant-based lunch, which is really bad. And before I forget, if you do leave early and skip the plant-based lunch, which you'd really be foolish if you did, turn in your CME forms, okay? So we'll make this quick, and then we'll go eat a good lunch and talk. We have a position statement. That really gets you excited, doesn't it? I mean, how many of you woke up today and said, I hope I'm going to learn about a position statement, right? Yeah, exactly. Well, it's in your handout, but what is this kind of thing? It's a point where you kind of articulate your beliefs as an organization about something. You try and build understanding and support, which is what we're doing today, and hopefully it's based on the best evidence that's been filtered through someone other than yourself, like a committee. So that's what we've done at SUNY Downstate. And here's the website, which I would encourage you all to go to. It's our website on the Committee on Plant-Based Health and Nutrition. One of the good things about being president of the medical and dental staff is I can just create committees. It's a wonderful thing. So I said, I'll create a committee on plant-based health and nutrition. About a year ago we did this, and this is the culmination of that. But it's on the handout, on the back of the position statement in your folder. I encourage you to go to the website, which is at the bottom there, and there's great resources. Evidence, for example, evidence summaries. You can see all the studies that are behind what I'm going to speak to you about now. You can see myths and facts documents. You can see frequently asked questions about all sorts of aspects of plant-based health, and there's even a really good getting started guide that sort of demystifies a lot of the aspects of making a shift towards more plants in the diet. So please go there. Now here's the question. I was introduced as the chairman of otolaryngology, right? That means ear, nose, and throat in English. So, I'm normally up here. I do a lot of speaking. It's normally about earwax, or, too many boogers in your nose, sinus infections, you're clearing your throat because you didn't eat enough plant foods, you got reflux, all right? So why should you listen to this guy, especially before lunch, talking about plant-based health and nutrition, right? Well, I'll tell you, it always begins with a case study. There I am in all my glory. I think I must have been about 2, right? You can see I was already becoming an advocate of good health and fitness and nutrition, right? You know? But don't worry, I was very interested in fitness, you know, getting the poses out there at that time. All right, good, you know, terrific. So then what happens? Well, my dad was really into fitness, and you get to high school and you say, all right, it's time to do something. Then you go off to college and you start pumping iron. All right, there I am in college, you know, 140 pounds, pumping away, the days of Arnold, right? Franco, Lou Ferrigno, the Hulk, right? And then what happens? Life. There it is, career, kids, and life, where all of you are now. 158 pounds. This was about 3 years ago, and I woke up one day and I said, gosh, it's going to take my kids forever to get married and have grandkids. Do I want to be around for that? I said, yes, then I better do something a little differently, right? So first I'll show you where I am now, then I'll show you what I did differently. So, where am I now? All right? That is not Photoshop. Don't ask me that, okay? Now, our BP talked about his 4-pack or 6-pack or pack or whatever, okay? So I'm 60 years old and change, all right? I have such fun teasing the residents in our training program about showing me their 8-pack and stuff. But yes, I really do this stuff. So how did I get from the middle to the right, you know? And how do you do that, you know? Well, I thought it was things I did, but I learned from Dr. Katz's talk that I'm manipulating my epigenome, you know? It's like, okay, so manipulate your epigenome. I suggest you all read Greger's book, How Not to Die, if you haven't done that yet. I mean, that is really the classic on this. And, you know, I'm fortunate in my family, one of my sons, who you'll hear from later on the program, Daniel, is really becoming an expert in this, and he's the one who sort of pushed this in the family. You know, stay away from the junk. You've heard that, right? Run. I started running. I never ran in my life. 3 years ago, I lost a little weight. I was late for a meeting. I ran. I said, huh, I ran 3 blocks. This is really cool. You know, I can run. And now I'm running 35, 40 miles a week and going to do a marathon in September. We'll see. Work out. Hit the weights. You can't just do, you know, exercise. I got to do fitness too, resistance training, all right? And there I am again, 8-pack, you know, got to go for it. I literally get up at 3:30 in the morning almost every day except weekends. Before coming here this morning, I ran 7.5, 8 miles, okay? Every day I do this stuff, every day of the week. It's a habit, all right? It's in the genes. Now I feel great. I got a lot more energy. I can still be awake even before lunch. My case, countless others, and volumes of research show that this works. So let's get into the real research part now. That's how I got interested in this stuff, and you know, I think you got to get a little mission-driven here to really spread the word. Okay, so what about this position statement that I know you're all just excited about? So here it is. Plant-based nutrition, emphasizing all the good stuff, can prevent, treat, and even reverse chronic diseases in adults. Now, this is a statement that has been accepted and endorsed by the medical leadership of this institution, the Medical Executive Committee. That's a big deal, all right? That doesn't happen in a lot of places. So all the luminaries, very few of which have come to this conference, but they're still luminaries, some of them are here. And, you know, they're actually, I have to acknowledge, Beth didn't acknowledge it to start, but we couldn't do this without support, and the Medical Executive Committee, medical and dental staff have generously supported this conference, as have the President's office, Dr. Riley's office. The Brooklyn Borough President has really helped a lot with getting the word out and organization, and there are others as well. They're acknowledged in the program. But this is the statement. So what does this mean? Well, we have a few things within the statement. First, we say that, you know, if you eat more plants, you have less of all these problems. You get all the good stuff. Now, this is only based on evidence from 700,000 or more people in various studies that are shown here. These are epidemiologic studies where typically at baseline they'll do dietary assessments, they might repeat it, and they'll follow people for long, long periods of time and then see how they do. But even at baseline, they have a lower weight, lower body mass, lower cholesterol, you know, lower inflammatory things, etc. Now, the real sine qua non in medicine is the randomized trial. You don't see a lot of this. It's difficult in nutrition and lifestyle research, but there are some. And that really helps you tell if treatment works. So what about treatment? What about randomized trials where we take a group of people with some disease, type 2 diabetes, being overweight, cardiovascular disease. We randomize half of them to primarily a plant-based diet and the other half to some eat what you want. Well, we see that you can reverse and treat all these problems just by changing your diet. And these studies go on only a few months, typically maybe 6 months or a year at most. A couple of the ones we highlight in our evidence report are shown here. About weight is particularly good. And the good thing about plant-based diets, you don't just lose weight, but you keep it off. You know, the problem with many of these diets, you lose weight, everybody can do that, but you don't keep it off. And coronary artery samples, two of the folks you've heard about already, Esselstyn and Ornish, I mean, are really luminaries, and I suggest you look at their books so you can prevent, reverse, and treat these diseases shown in randomized trials. Now, you don't just want to have a population study and randomize people, you want longitudinal. You need to see what happens over time. And that's where a lot of these real big population-based studies are helpful. Some of them are going out 20, 30 years now. Median follow-ups 10, 12, 14 years on samples, which is great, you know. So what's the longitudinal impact of this? Well, if you eat more plants, you're less likely to develop hypertension, heart disease, type 2 diabetes, colon cancer, gastrointestinal cancer, etc. You know, this is shown in these studies. We're not going to get randomized trials that go out 30 years and control everything, but the data are there. And again, these are some of the main studies, big cohorts that are out there. Collectively, over 700,000 people and growing. And they find new ways to get information. You know, like they say in epidemiology, a fundamental statistical principle is if you torture the data sufficiently, they will eventually confess to something, right? So if, you know, people are torturing these data sets in new ways, looking at indices of healthy foods and et cetera, and it's really showing the benefits of this approach. Now, other longitudinal things, probably the most important longitudinal outcome is death, right? Mortality. Well, good news. Eating more plants, you're less likely to die from all these chronic diseases, ischemic heart disease, cardiovascular disease, cancer, pancreatic, lymphatic, and hematopoietic cancers, as well as all-cause mortality. I'm not sure if that means the taxi person on Clarkson Avenue hitting you with their illegal cab, but it might help with other things. I don't know. Good evidence out there. Vegan versus vegetarian. Do you have to be all in with this, or can you just shift to the plants? The evidence is not robust on this. There are not a huge number of studies that strictly randomize to a vegan, whole food, plant-based versus vegetarian, but the ones that do are starting to show that you really do better if you stick to the whole food, plant-based, than if you just get your toe in the vegetarian end of it, okay? What else is in that position statement? A few other statements that we're really pushing here, as much as Meatless Monday would be a global sensation and eliminating all type 1 carcinogens, who processed meats would be great, we're just looking to push the needle towards more plants. And that's what the evidence really shows, is the more plants, the better. A whole food plant-based diet, which I'll describe briefly in a moment, seems to be the way to go if you're going to pick one of these. And there are all sorts of different diets in the studies. It's hard to figure it out. And as was nicely, it's all about lifestyle medicine. And yes, diet is at the center of lifestyle medicine, but there's a lot of other good things that people do when they're eating better, and that may confound a little bit our interpretation of the outcomes here. Okay. So let's, a few words on what is all this plant-based nutrition. Now that you're hopefully all revved up about it from the borough president, from Dr. Katz, and now this thrill-a-minute position statement, right? Okay. So let's take a look. And you can raise your hand. How many of you are omnivores? Come on, fess up. Yeah, there's a few of you out there. I'd say 10%. All right, let's go up the chain now, all right? Flexitarian, the new word. You wish you were vegetarian, you're not. You still eat some meat, but you pretend that you're vegetarian. How many of you do that? Yeah, there's a bunch of you out there. Another 10% popped in. All right, the semi-veggie folks. You're a good veggie, but you slip in a little chicken and fish now and then, right? I did this for most of my life. How many of you do that? Oh, there's a couple of you out there. That was like 5%. Vegetarian. There you are. You might eat some dairy, some fish. Who's that? Vegetarian. Very few, very few. Okay, 5% at best. All right, now we're going to get really tough here. Vegans. All right. Wow, probably about 15, 20% of the audience. Very good. Now the ultimate nirvana and self-actualization and dietary and lifestyle change is whole food, plant-based diets, right? Who really does that? About 10%. I've been doing it now for about 2 years. It's not easy. But whole food, plant-based diet. So that's the direction we want to go in, more plant foods, less animal foods. I don't think you need perfection, but that's where you want to go. Now, what is this whole food, plant-based diet? Well, it means you're going to eat the good stuff, right? The fruits, the vegetables, the whole grains, legumes, beans, nuts, and seeds. All right, you're not going to eat too much of this, the refined, processed stuff, you know, the extracted oils, even heart-healthy oils like olive oil, which is only heart-healthy because it hasn't been compared to other things that are healthier, as was said before, but extracted oils are in general not very good for you. They're fairly empty calories, and you're going to avoid this stuff. If you do that, you're following a whole food, plant-based diet. But it's boring, right? Eating lentils and grains and chickpeas and nuts, right? It's boring here. How can you have fun eating whole food, plant-based? You know, food is the joy in life. Well, I mean, there's a lot of good stuff out there. And you'll see it with lunch. And to a lesser extent, breakfast. But lunch, you will see it with lunch. There's good stuff. How do you learn more about this? You know, a conference is one thing. Again, go to our website. We put a lot. What's different about our website, I think, is we've tried to be very evidence-based. So we've taken out the hype in a lot of these materials, and they've been looked at by dietitians, by nutritionists, by medical students, by practicing doctors, by community folks, by public health professionals. So there's a lot of great stuff there that we're happy to share with you. And there's a table out there about plant-based world. They're bringing it right to your doorstep, the Javits Center. It's coming. You know, the 7th and 8th, really major big conference on this. I signed up for this. I think it's going to be a lot of fun. This was mentioned before by Dr. Katz, this global burden of disease, where now it's diet. I mean, diet is driving chronic disease in the U.S., especially things like diabetes, type 2 diabetes, the cardiovascular, some cancers, right? Stroke. The hyperlipidemias, the cardiac profiles, prediabetes, obesity, it's all being driven by diet. Yet we don't talk about it, and we talk about it here, but not in general. If you haven't already seen it, see Forks Over Knives, okay? I mean, you can get it on Netflix free. Everybody's got Netflix now, I think. It's kind of like, you know, it's ubiquitous, but it's the story of Campbell and Esselstyn's, you know, quest for this and their research where they follow patients who are really, really, really sick, have had multiple bypasses and other problems, multimorbidity, not just a little morbidity, multiple chronic morbidities. And most interesting, I thought, was the producer, you know, Lee Fulkerson, who kind of took this thing on and said, while I'm doing it, I'll go whole food plant-based for a couple of months and see what happens. And he just dropped his weight, improved his cardiometabolic profiles, and really did well. So that is the end of what I have to say about the position statement. And You know, I think the committee, the position statement was great. This conference is really a turning point for us. We're really blessed and delighted that you have ventured here today and are sticking around. And again, thanks to Dr. Katz. I know the borough president had to leave, and upcoming Dr. Ostfeld and others for sharing their wisdom. And hopefully this is the start of some big changes in Brooklyn that you'll all be part of. So I don't want to do Q&A because it's noon. I'm happy to stick around. If anybody has a particular question, just come up. But it is 11:58, and it is always better to release you for lunch 2 minutes earlier than 2 minutes later. So there will be people outside guiding you to the lunch, which is a short walk away. Enjoy, and we'll see you back at 1 o'clock.